other topics, and then we'll open it up to a discussion.
I did not have a chance to present my works this morning, but I'm glad that Farah Abbasi included me in the panel. Thank you for giving me this opportunity. So when I heard all the presentations this morning, and particularly your presentation, and it's very important for you to know where I am coming from, and we were in essence doing the same work in our own towns, and part of it is overlapping and other part is really unique in my work. So I will be responding on the basis of my 3 works which I have done with this community. One is Muslim women's encounter with Ingham County Health Department and their social, cultural, religious barriers to seek the services. The other one, which is more directly related to your work, is Muslim youth in Greater Lansing area in the post 9/11. And currently I'm writing a chapter on Pakistani Americans, their immigrant experiences, and I am looking forward to present that at some future time. So in order for you to frame your questions in a broader Muslim youth experience perspective, I would like to give my position. So what I assessed was that during the whole day of deliberations, Muslims are attempting to find a place in American society. So soon after, in our research, soon after 9/11, we explored the experiences of Muslim youth in public schools of Greater Lansing area. The most important objective of our study was to identify factors affecting their self-esteem and leadership qualities. We explored their experiences with their classmates, with school teachers and parents, and these aspects are very critical to their sense of safety. Shamoon talked about safety, so I will highlight those points in this. So we really asked them how they thought about themselves, what were their major fears, what were their thoughts about themselves. So we assessed their sense of safety by their school performance and related anxiety to school performance. So that the goal was that we could initiate an effective communication, an effective dialogue between youth, parents, youth and school teachers, and youth and their peers. So because of this, they feel a sense of community. A sense of community is a sense of safety for them. So school climate is very important, whether they have to go against, they feel pressurized against their religious values, and how do they respond to that. So the climate of that time, basically racial profiling, stereotyping, perpetuated in the media, reinforced by the events away from the United States, US's involvement in Afghanistan, Iraq, and Middle Eastern countries. So there was a sense of perceived discrimination, a heightened sense of perceived discrimination due to their Islamic identity. So we conducted focus groups, youth surveys, focus groups of parents, and focus groups of school teachers, so that we could come up with some policy implications. For youth, we went in depth to conduct a very sophisticated scientific survey. We had some structured questions and we had some open-ended questions. So we really got a good depth in the data. So our analysis indicated that youth's self-esteem were associated with school anxiety and academic performance more than any other factors. So anxiety about getting good grades, not fitting in, and not understanding the homework, etc. Who were our school children? They present a very diverse population of Greater Lansing area. There were new refugees from Afghanistan, Iraqis, Bosnians, Arabic-speaking, Pakistanis, Bengalis, South Asians, Somalis, Malaysians, name. We had about 91 children with whom we could get a complete data set. So for them, pressure against their values or religious identity were not that important, or parental support was not that important. For them, performing in school was very important. So in those ways, in open-ended questions, they shared their fears of personal safety, perceived discrimination, isolation, and depression. They really identified their pains, and they shared those with us. They asserted that they are no less Americans than others. They informed us what their teachers and peers need to know. So on positive side, in spite of their experiences, they were positive about themselves and were hopeful about their place in America. They worked very hard. That was their anxiety about school performance. They worked very hard. They earned good grades. 50% of them got A grades in their math and science courses. They participated in sports. They thought they make good choices. So they thought of themselves being very good leaders because they make good choices and they easily make friends with their peers. So that's positive. On the negative side, they attributed the negative aspects of discrimination and being picked on and not fitting in well to what was being portrayed in the media, and they proposed that media needs to correct themselves and present true Islam so that we are not target of these hate which is in the environment. They wanted those images to be changed. So I think that if negative effects are not addressed appropriately at all levels, and in my focus with the schools, with school teachers, if they are not educated about these ethnically diverse Muslim communities by gender, and media programs are not appropriately portray Muslims, we would be creating a new class of traumatized and stigmatized youth out of these young Americans. So all Muslims are not Arabs, all Arabs are not Muslims, and all Muslims are not terrorists, as Farah said a minute ago. So I don't think I am responsible for actions of over 1.5 billion Muslims who inhabit more than 35 countries around the world. Most Americans, most Muslim children are not responsible for the acts committed by Al-Qaeda terrorists. They are not responsible what is happening in Pakistan, and Taliban are committing all those acts of violence against their own people over there. So however way we look at it, there is a great need for engaging ourselves with school teachers, with other community leaders, and particularly parental engagement with schools, their active participation in civic activities and other organizations. So on the basis of our research, particularly from teachers' side, they asked us that all we need is that parents and Muslim community leaders come forward and share with us what we need to know, provide us a list of things to do, not to do, so that we can easily accommodate them. When I say easily accommodate them, is that during the month of Ramadan, if a Muslim student is fasting, don't invite the students to be in cafeteria, provide them a separate room. I think that can be arranged without much cost. If a young Muslim woman does not want to take part in a certain athletic activity like swimming and does not have a private locker to change her costume, she does not want to participate, she should not be stigmatized. So those are my comments, and Zen is saying you are done.
Okay, appreciate it. Thank you.
I think Samir and I spoke our piece, so I think thank you.
You guys spoke your piece? All right. Well, I'm feeling a sedated type of sense. Are we a little sleep? Do you want to stand up for a quick second? You want to? Because I'm feeling like this. So, what I'm going to present upon today is just going to be a few minutes. I didn't expect to talk more than 5 minutes. I don't think I'm going to talk more than 5 minutes. I'll talk 3, and then it'll end up being 5. So anyway, I'm Halim. I'm Halim Naim. I'm the president, the newly, I guess, appointed or forced or whatever, coerced president of Muslim Mental Health, the organization. We have the Journal of Muslim Mental Health that Dr. Ahmad Hamid was or is, I think still is, editor of. But in the actual organization, just wanted to convey to everyone what the direction and what we're trying to do here is about. A quick little story. I don't know. I guess it's coming upon me to, I guess, say it's a short one. But Dr. Akberg, it's very ironic. Right before, one of the reasons I came in a little tardy towards the conference is a friend of mine was talking to me about another close friend of mine who's been in the military for a while and has engaged in some of the activities that Dr. Akbar had mentioned. And his post-traumatic stress is severely detrimental right now, to the point where he's trying to get other people to take his life. So that's been on my mind all day. And where does Muslim mental health come in with things like that? Well, what's the largest, I want to ask the audience and engage, what's the largest religion in America right now? What religion would be classified? Anybody, just blurt it out. Christianity, right? There's a far second to it. What's the second largest religion? Islam. What? The second largest religion in America is Islam. Just by numbers. You can look up the census, you can look up all these other places. So the thing is, as we all know, Islam's not going anywhere in America. Okay? Christianity has been made to be America's religion. Judaism is also America's religion. Buddhism is also America's philosophy. And guess what? Now let's try and do a little experiment, a phenomenological experiment on ourselves, right? See how you feel. Islam is America's religion. How does that feel?
It feels really good.
Okay, good. Somebody says it feels good. You know what? It feels good to me too. It felt good. Don't you feel invigorated? Did it wake you up? Like, ooh. No, I'm just. All right. So where does Muslim mental health come in? What's happening here at MSU, and what MSU is trying to do in terms of the direction and the Institute for Muslim Mental Health, is historical. It's something that we tell our grandkids about, because we need a professional and expertise, a reference point, to start to explain some of all these things that are happening. The highest rated group of people in the world are Muslims, in terms of what gets the most Twitter posts, what gets the most ratings, what hits the news the most, right? So what is the combining expertise of mental health professionals? What are we experts in? We are experts in analyzing and observing human behavior, right? And with some motivation of behavior. That's what we do, whether we do it neurologically or theoretically or unconsciously or psychologically, that's what we do, right? And some people are better at it than others, or more trained, or what have you, okay? And what's happening right now, what you see in the media, what you see in all these other places, is everybody else, people who do not connect at a deep level, are speaking about people like my friend, speaking about stressed out people. They're speaking about it without knowledge, without expertise, unacademically, and affecting the lives detrimentally of those around us. We need an expertise. We need professionals. We need a new standardization of how we are going to approach the behavior of America's religion, along with Christianity, Buddhism, Judaism. The coolest thing about America, the coolest thing about this country, is that anyone can come here, be born here, be raised here, keep their trait, keep their ethnicity, and still be American. What is happening right now, this war on terrorism, it's not a war on terrorism, it is a war of terrorism. It is to incite fear in terms of people's hearts. Look at it psychologically, the people who look at journals and things like that. We need professionals. We need people. We need a reference point to start to be like, okay, who do we go to? How do we explain this? How do we explain what's going on? And that is where Muslim mental health is leading the charge. And it's backed by some of by one of the most credible and authoritative sources and cutting edge types of things. We now have assessments to assess spirituality in Islam. I had to wait along my dissertation. I'm using some of the first assessments. It's something you tell your grandkids about. Valid psychological, psychometric assessments of that. Things like that. We need a reference point. We need something like this to start to explain our behavior so that people like my friend can get some of the services, have some of the expertise and some of the training and some of the help that they need. You don't just throw people in the psych ward. That's what I want him where I want him to go, but 1 minute or 30 seconds?
Two.
I got 2 minutes left? Oh man, I thought it was
1 minute.
Oh, 1 minute? I'm taking stuff away. All right, just 1 minute. But I want to be able to properly inform the system of whoever helps my friend, and not just throw him in there into a place where he can't be trusted. So if he goes into a psych ward, how does his attachment with God play into some of the trauma? We don't have a reference point for that yet, but now it has come. It's come. So anyway, thank you so much, and again, joining the Muslim Mental Health or being a part of Muslim Mental Health organization, it doesn't require that anyone is Muslim. It's about knowledge, it's about expertise, it's about wanting to make a positive difference for people in life. So I think I'll call my moderator up, I think. And I think that's that, and wish everybody a safe and happy journey and all that. Thank you.
Okay. But you put put me on the spot. I think it sounds like, okay, well, thank you again for we're very excited about your work. We've talked about multiple levels in which the social political situation impacts mental health, and we've talked about resilience and interventions. I give my 2 cents about ways we can get clergy involved in proactively addressing the emotional distress of Muslims. You heard from Samira, you heard from Zayn about getting the youth involved into the youth programming in terms of proactively preventing people from suffering from emotional distress. And I think there's a lot of exciting research that's emerging and a lot of exciting collaborations that hopefully will emerge from this conference. With that, I'll open it to questions. If there's any last questions, we've had a long day.
I have a question for Dr. Ahmed. I was shocked to see the stats you gave, two areas of college graduates, Muslim college graduates. They are outnumbering the Americans in sexuality and smoking.
In smoking only, not in terms of sexual activity. Yeah, that was 53.3% of the Muslims who are, I think it was 60% of non-Muslim peers.
Well, that's then the role of the chaplain, you say the professional chaplains. These two indicators are very startling, especially what are the indicators for smoking, why do they smoke? And the other thing, the sexuality, you said that culture inclusiveness is the key, one of the key elements to build the bridges. Is there inclusiveness on both sides or only one way inclusiveness? And then the impact of inclusiveness is also the way it looks like, the impact of inclusiveness in one way, the sexuality and smoking is on the right. Because these are the United States.
So the question is,
why? And then the second question to you, what is the role of chaplain?
so why is it that we're seeing such high rates? So for those of you who might come later on, one of the things I talked about in my presentation was the high rate of risky behavior amongst Muslim youth. And the reason why I actually started that study is because I started off in the area of looking at Muslim youth from a similar area where Zain, I think, was talking about looking at it from positive psychology, because I think it's really important to see what's working and how to enhance it. But one of the things is also, beyond being a researcher, I'm very active in the Muslim community and involved with a national organization that looks at Muslim youth called Mass Youth. And what I was finding over and over again were many of these risky behaviors that seemed like they were one-off incidents were actually very prevalent. So we wanted to look at the risky behavior, because what would oftentimes happen, we would tell the parents, these are the issues, and many times people would deny it. Oh, it's not as big of an issue, it's maybe one or two bad kids, parents didn't parent properly. And so we started this study, and it was really basically secondary data analysis from research that was collected from Harvard. And what we found was, in this process, that there is indeed a high rate similar to their non-Muslim peers. And then the reality of the matter is, they are American. And they are a product, both the good and the bad, of this country. So in terms of addressing, one of the issues that I think as the Muslim community is failing in is we live in this bubble, and we think things will not happen to our kids. My daughter will not, have these issues. My son will not have these issues, and so we don't talk to them about these issues. We don't talk necessarily about our values. We talk at them, but not with them. And that's a huge difference. And so when you start having those communication lines, you start developing the relationship and can kind of discuss, why is it you feel this way? What are the issues? And what are the positive and negatives? And so I think that's lacking within the Muslim community, and that's something that we need to speed up. Even basic things are basic drugs. How can you identify if your child may be using? What are the risk factors? All that. The average Muslim parent isn't aware of these things. So I think that is an issue of concern that we need to address, and address immediately. The other issue is from a community perspective, and Zain, I talked about this earlier, and Zain also addressed this. There isn't that acceptance. There isn't that space where they can be themselves. Because if they show their real self, they're going to be reprimanded either by their family, their community, all that. So they don't have a place where they can really figure out what their identity is. And so I think that's an issue that's also concerning them. And I think the other question...
You answered that. The other question is related to...
So I think to remember that Islamic chaplain are religious authorities, if you will, that are.
If you're going to interject the second part of that, then you can probably answer that. Do you see any projection on the rising those two levels?
I expect it to be much higher than it really is. I think the problem is we're not engaging young people. My estimate, based on just not necessarily research, but just working in the community for like the last 15, 20 years now, is that majority of the Muslim youth do not actually come to the masjid, do not actually come to the mosques. And part of it is because they've been alienated. And in that process of an alienation, they're finding other places where they can be themselves. And that's really important for us to start understanding and addressing, because if not, we're going to lose them.
Exactly.
I mean, I have a 26-year-old son, did not drink, simply because I was on this case all the time.
And that's what the research is
And
finding.
it's up to the parents, not, to make sure that these things just happen and that their children, have the values that they have.
And-
So I would basically just say it's, the rise, smoking for Muslims, it's awful.
It's everywhere. Yeah.
It's everywhere.
I think what the issue for a lot of Muslim parents is it is shocking to them because of the religious taboos and cultural taboos that how could this happen? And I think a lot of other parents may be more realistic about the issue and be more proactive about addressing it.
Everything that's out there.
Exactly.
I also think this may be a generational thing.
Yeah.
Where people who grew up here, like yourselves and myself, who are parents, recognize that alienation, acceptance are human problems, and the way to grapple with those problems are often turning to drugs and alcohol that many humans, whether you're Muslim or Christian, deal with. For people who came to this country, they tend to blame it on, it's the American culture, it's the American way, and not recognizing that maybe in practice it's just a human problem that needs to be dealt with.
And it's actually happening in their home countries as well.
Exactly. And that was the point I wanted to bring up, is that I'd caution us as a Muslim community to always, it's because we're in America, it's the Americans' bad influence. Because you brought up the word inclusivity, like what's implying there's this relationship of inclusivity into the society and these risky sexual behaviors, cigarette smoking, shisha smoking in the Middle East or in Pakistan, or sexual behavior is ubiquitous. It's not an American phenomenon. And I'm sorry.
We haven't captured that honor totally.
Right. And so that's one thing I wanted to raise. In terms of the role of the Islamic chaplains, remember that Islamic chaplains are specifically working in the context of those institutions, the military, hospital, university. And so they don't really have much. I really think the role is in community building and the youth programming in terms of preventing kids and young adults from doing bad things.
I have a question about the professionalization of the Muslim chaplains. Are you proposing a uniform curriculum for them? What kind of, they are so unique and so diverse in their own communities and their experiences and their perceptions of, what is mental health or not. It's going to be a very challenging task. So, what kind of curriculum will you propose?
Right. So, it's not so much my proposal so much as there's a discourse around the development of core competencies for Islamic chaplains. And what I'm trying to suggest is that as these core competencies are developing, that we as mental health professionals should be at the table. That right now, who's at the table are religious studies people, and then basically, to be quite frank, chaplains, because remember in Islam there's no clergy, so basically anybody can be an imam. I can pray and get a beard and say, I'm the imam of this community. And so they've been grandfathered in these chaplaincy positions. And so they've been taking this leadership. And so what I'm suggesting is I think some of the core competencies we want from the Islamic chaplains are to have some basic counseling skills, some basic recognition that there are mental illnesses, and to screen for that. And I teach a course on basic mental health, which Samir has lectured on, and just to kind of give them enough information to be dangerous. That's I like to say, but there's some core skills so that they can at least screen. You know, imams. When people come to imams, you really think they screen for alcohol or suicidality or whatnot. So I want to kind of get the Islamic chaplains to that's a part of their training and certification. Yeah, sure. You.
I just have a quick question having to do with the Muslim Mental Health Association. We're fortunate in terms of looking at populations here in this society because of a certain amount of education and acclimation to certain methods of treatment. Do you have in your mission or mandate the idea of, because I think you're uniquely positioned to do this, of developing methodology that can be considered culturally appropriate to be used outside of the country? We work with the Gaza Mental Health Center and the collection centers in Annapolis and so on. It's very different when you go in there and talk about psychology and mental health. And if there was a way of a professional and trained core of entry group developed here in the United States to take on how could the essence of assessment treatment be offered to professionals who often are looking and struggling with that population who certainly need it. You're looking at PTSD, it's like daily life in many areas, and how that can be offered in a sense as an assistance to developing those kind of human services and culture.
Right. So I'm going to start to address that. You can Talim. So kind of the history of the organization. We were very young. We were very small. Is that actually when I was a resident, a psychiatry resident, I was kind of growing up in this post-9/11 era, whatnot. Recognized the need to develop tools to assess that are culturally sensitive, psychometric tools to assess the situation of Muslim Americans and Muslim globally. The other goal of the journal, Muslim Mental Health, the academic peer-reviewed journal, is that we have this 90-10 phenomena in which 90% of the resources and research is focused on 10% of the global population, i.e. the West, and that there's not as much literature in terms of just basic epidemiology, prevalence, incidence, risk factors in the rest of the developing world. Now, Islam serves as an interesting rubric in the sense that, as one of the speakers mentioned, people kind of identify themselves as Muslims. When they talk about resilience and spirituality, Muslims across the country kind of draw from the same kind of language and discourse. So I think having a journal on Muslim mental health is useful, and there's a value to that. So the organization actually started after the journal was started to kind of help organize the journal and finance the journal and whatnot.
It's not an unusual process.
Okay, I thought we were the exception. But and so around that, we've kind of organized ourselves. And what we want to do, and what we've started to do, is organize a network of professionals, including researchers. So we do have, many of the studies that were quoted, Asim Fadela and Wahiba Baraz, are part of our both social, professional, and hopefully formally organizational network. And so what we've done successfully so far is publish articles that have been really seminal in terms of developing methodologies for assessment. And also what we've done is paired young graduate students with mentors, such as Wahiba Baraz, who's done much of this work. So we're slowly working towards that with that in mind, and helping culturally competent methodologies, hopefully starting to even publish policy briefs for the global community and whatnot. And so, but I would love to talk later after this in more detail with you.
Maybe some other questions since we got two. Yes.
A comment and question. I agree. I think that a lot of the things that a lot of the problems that you see in acting out behavior review persist directly from a suppression of the conversation. We don't have that conversation, and I think that's not just the Muslim talk to people who are just like, not trying to have any sort of structure in their life. They were like, back home was hard, and we didn't talk much about any of these issues. And now it's here. The taboo thing is right in front of me. Everyone said don't press the button my entire life. No, the button's in front of me. I have to press them. And my scares though, like as if I'm just kind of coming into the field. It's like how do we address these issues? How do we? And I think that you're right. It's important to address them. But how do we do it? Della Lee came to Lansing Mosque about a year and a half back. We talked about the incident with Bridges TV. And he talked about domestic violence. Another covert issue pretend it doesn't happen in the community. And it happens, I think, with a very dangerous nature to hide it. And I also want to say that we need to, there's a myth that adults don't engage in these ideas. There's in the literature, it looks at a lot of infidelity is highly correlated with domestic violence in Pakistan, India, and Bangladesh, and amongst men. And it's very disproportionate on what we deal with, who we tend to. But how do we deal with it? Because people are walking up to Brother Walid after and saying, this isn't an issue. And people, you get threats. And I'm interested to devote my career to demystifying these conversations. But how do I do it when there's already these placed barriers within the community? How do you do it?
I think we have to be pragmatic, and no one person is going to be able to do it all. And I think we need to really network with each other and be smart about how we approach it. So we have a few efforts that have been underplay. Hamada has been really instrumental about getting the journal together, and that's really opened up an avenue and a place for the journal, for people to publish the research and kind of gather as a great resource. And hoping with the Muslim Mental Health Network, as it establishes itself, it is able to do that. And then we have the email network as well, which also brings people together. We're hopefully publishing a book, another volume, where a number of individuals here talk about Muslim mental health issues such as domestic violence in terms of intimacy issues facing converts, issues facing, if someone goes into inpatient setting, what are the issues that a non-Muslim mental health provider who may not know a lot of the intricacies that may impact the treatment of a Muslim client. We're publishing that. That's coming out in September. But these are all small efforts that we're doing individually. And I think part of that is to figure out what you can do and do it, and then network with other individuals. One of the things I also do beyond the research and that I do is educational programs. Get in touch with the khatibs. If you can give a khutbah, give the khutbah. I mean, my husband does khutbahs, and half of his khutbahs I write, and I tell him these are the points I want you to address, and the issues that he brings up are extremely relevant for the community, and it is open to discussion and is slowly impacting change. But you need to get all the players there and get them involved in different aspects so you can slowly make change.
I want to pick. I'm going to get real good the question real quick. I want to piggyback real quick off of the word relevancy, and I think what you're doing, Zain, and what Farah and what I'm trying to do myself or what have you. It's actually about to address this issue of what do you do when there's such a disconnect? You simply become more relevant. If you look at the religious history of Islam, of Christianity, or what have you, one of two things actually happened that perpetuated certain ideals, certain orientations, certain schools of thought, or what have you. It was either done with force or power, but what permeates and is sustainable is because it was more relevant. Different parts of the world, maybe a little more spiritual or what have you, so you have a little more spiritualized version of Islam. Why? Because it's more relevant. Okay, so what does relevant mean here in America? It means you got to incorporate music, take some type of stance there. If you throw it all out, you've thrown yourself out. That's just how it is. Okay, you have to take a stance on certain key issues, not just throw out sex, but how do you have sex? How do you approach someone? How do you get ready for marriage? Versus throwing it all out. the more relevant you make yourself, then anyone will come and talk to you, and it's sad, but your opinion will have more weight than somebody who knows much more than you about Islam, because you're just more relevant. I know he knows what I'm going through and what I'm talking about. So that's it.
And that, excuse me, and that also goes back to what Howard said.
Yeah, exactly. I was just piggybacking. Yep.
Engaged
Yep.
in the community at all levels.
Yep.
All levels.
Yep.
So your voices are heard.
Yep.
And people are educated. And like this conference, I mean, it is fantastic.
It's about relevance. Yep.
Good job.
Yep. In the back. Yes.
Yes.
Yes, ma'am. Yes. Yes.
I apologize, my question is very hard for me to frame, so I hope you'll be indulgent and maybe help figure out what I'm trying to drive at. Dr. Hamid, I think it was on one of your slides, the top one was biomedical, something or other, and the second down was psychosocial, and at the bottom was spiritual/religious. And the biomedical especially was echoing my hearing from Dr. Megan, I think it was, that we have wires in our body. And I've not quite understood, because I don't think human beings are machines. But, and spiritual came up elsewhere. But psychosocial, this was psych combined with social. That was interesting. Some people here today are psychiatrists who have been here, and some are psychologists. And in Greek, I don't know Arabic, but in Greek, the word is psyche, means soul. And we are in a religious context. We're talking about a religion, Islam. We're not talking about people identified by country of origin, or gender, or race, or ethnicity. So it seems to me to bring up suke sort of in passing and combined with the word social can be very confusing, especially when we saw a lot of images of brains. And I do ask questions like this to Christians, by the way, and find that the answers seem to represent an understanding at a fairly primitive level. Because I take it in Islam, after death, the soul has survived. There is a soul, and the
Yeah,
soul has
I think-
survived, and the brain has not. And who?
I think
What's
we-
the
I think-
relationship
yeah.
between the brain and the soul?
Right, I think that's a big philosophy question. Okay, so I think you're reading too into that term. That term I didn't coin, psychosocial, is kind of psychobabble doctors use. Is this a term that means psychological and social? That there are psychological and social factors that inform emotional distress and mental health and mental illness. And that slide and that kind of portion of my lecture, I was demonstrating how people conceptualize what are the different explanatory models to emotional distress. So some people explain away emotional distress as being purely neurological, that because of chemical imbalances, people feel depressed. Okay, some people think that way. Some people think that emotional distress is a result of psychological or social forces, and so I was trying to use that kind of those paradigms to demonstrate how this does or doesn't relate to Muslims. I wasn't going too much into philosophy or existentialism.
But it isn't a philosophical question. If you are, if you believe a human being has a soul and is also a physical being, at least for the rest of the time, then it's not a philosophical question. At least these are coexistent. And how could mental illness not have to do with the soul? And what you've been describing relates to reaching the soul.
Okay,
Is that just a silly question?
No, but Helene is eager to answer.
I don't know why I want to jump on this.
Why do you want to jump on me?
Not you. This. No. That's one of the contributions, in all honesty. There's only like 20 or 30 here, so I don't think the secret will get out. But that's what I think Islam will bring to mental health and to psychology. We'll revive the spirit. We're going to revive the spirit. Because in actuality, a way of looking at it, not to say, a number of Muslims, but I guess I'm the president, I can say what I feel is the truth. No.
Maybe a coup.
It may be a coup, I know. No, but I'm saying the point is it's all connected. It's all connected. There is, when we pray, when we do things, it is not just a physical act that is happening. There is something happening with our soul. There are things, there are brainwaves. It's actually been studied with our mind. There is something happening with our heart. It's all actually connected. What psychology has done, what a medical or deficit model has done, is it has compartmentalized what used to be unified back in the day. I mean, not to say there aren't people now, but I'm about to get thrown out, so more will come later.
Just to expound on what you're saying, I think all that boils down to is in postmodern Western thought, religion has largely divulged itself from the sacred.
Yep.
So the secular and the sacred are not the same. Islam, as Thomas Friedman said when the Danish cartoon controversy was going on with the Prophet, he talked about how Muslims are still trying to retain the sacred, that they still hold the value of the Prophet and his image and not, sort of displaying that as something that they don't want. They hold on to things that are sacred. I think this modern context of America brings a lot of these issues to the forefront, and we need to talk about this. And this is a good launch.
So it wasn't a bad question.
No, it was the best question.
It's a larger narrative.
It
that
requires
is-
another conference.
Yeah, it's a conference
It's a
all by
larger
itself.
narrative that it is not unique to Islam, but sort of all religions in dealing with the sacred and the
It's an
secular.
ongoing nature versus nurturing debate, and
In a
you
sense.
have to keep
In a way.
dialogue in that.
In a way, yeah.
I just wanted to say that I'm having like a post-traumatic stress disorder right now. Recreating complex, making the complex question more complex. As a sociologist, I like to sort out and compartmentalize the complexities. So that's totally a different question for me for debate, and whether we have a soul or a brain, or what departs and what remains, etc. From psychosocial point of view, psychological is your individual cognitive abilities and whatever you are, and social is your cultural environment. So in simple sense, I would say that individual exists relative to others in the groups, communities, and society. So they both affect each other in creating whatever they are creating. So it's very important to address those at those two levels. So I think if I need to seek a treatment for my stress disorder, so please keep that in mind. Okay, thank you. Thank you. That's a good question.
I guess we should wrap up.
Yeah,
President?
that's right. Oh, yeah.
Well, and I think too, you always remember that the attention span of the average American is about 10 minutes.
Generational.
So I really appreciate you bearing us all for 8 hours, actually. This brings us to the end of the conference. I thank you all, dear. And I would like to bring Joe once again. Thank you so much for being here, for supporting this conference, Joe. Thank you very much for your grant and help. And please, I will let you have the last word.
I'll actually let you have the last word, but if I could grab just 1 minute of your attention, I know we're all tired. Two things, housekeeping type things. There's a folder in the back as you're leaving the auditorium for evaluations, and we really appreciate your feedback regarding this conference. If you found it helpful, if you didn't find it helpful, you found it stimulating, what parts you did and what parts you didn't, we would really appreciate your feedback. The folder for that is at the back of the auditorium. The second part is, and I'll admit this was actually a thought I had as I was sitting here at the conference, sort of taking this all in, that we had a great turnout today, that people, that this wasn't just a conference where there were speakers and lectures, but that there was interaction, that the things that were stressed was communication and education, and that if we continue to communicate and educate, that we can make some headway on important issues, particularly in mental health and societal issues. On that note, speaking of communication, as Farha mentioned, part of this conference was funded through the generous funding of the Minority Fellowship Program. I'm the second Minority Fellow from Michigan State University. Farha was actually the first, and she actually got me to apply for it. Now, this is not an undistinguished award. Each year, I think they award probably like 20-some, so it's a select group, and these are people from Stanford, Columbia, Yale, Harvard. It was really great to see Michigan State University's name amongst those organizations. As I mentioned too, this conference is something that is not being replicated elsewhere, so it kind of puts us on the map. Each year, they reevaluate the program because, as you know, in these economic times, everyone is reevaluating their funding of programs. So I've been asked, as have the other fellows, to write a letter on behalf of our experience with using the fellowship funds for programs and how they've benefited people. I would like to ask anyone who is interested, I have the email of the program coordinator for the Substance Abuse and Mental Health Services organization, who actually, that's where the funding comes for the minority fellowships. If anyone would be interested in writing either a short email or a letter, basically, if you felt this was useful, if you would like for it to be something that is repeated each year, if you could express basically your support. Well, I'll have to actually look at my. If you'd like that, would you guys like me to tell you it now? Or? Okay. All right. So you would actually. Let me look here. Yeah, it's Marilyn King. That's who the letters or emails should be sent to. So it's spelled Marilyn, last name King, like it sounds, King. And it's at the American Psychiatric Association. I almost feel like this would be easier to write down and distribute to people. American Psychiatric Association, 1000, as in the number 1000, Wilson Boulevard, Wilson Boulevard.
Arlington.
In Arlington, Virginia, yes. Suite 1825 in Arlington, Virginia, 22209. If anyone didn't get that, I can certainly repeat it for you at the end of this conference. Now, like I mentioned, this was a thought during this conference. The deadline is March 29th, so that's Tuesday. It doesn't have to be a long letter. In fact, I think they'd probably prefer if it was just short and simple, unlike me, stating your support for this program, because we can't always count on the funding each year. Or M. King, just like it sounds, MKING, at psych.org. What's that?
You mean Pacific.
Yeah, and actually, let me make a small correction. The letters go to Marilyn King, but they're actually should be addressed to. Here's another name for you to write down: Pamela Hyde, spelled Pamela. Last name Hyde, Hyde. That's actually the Substance Abuse and Mental Health Services Administrator, and that's actually who you address the letter to. But you can't send the letter directly to her. It has to go to Marilyn King, who's the coordinator for the Minority Fellowship Program. Again, if anybody missed that, I can repeat it at the end of this, but it would
She
be.
has no relation to Senator Kennedy.
No. No. So again, thank you all for attending, and I'll let Farha have the last word.
I really appreciate your help with the conference. I appreciate everybody else who came together to help me. Atra, my daughters. Zen, thank you. And thank you, Dr. Vanplo, for your support. Steve, Sylvia, Kay, everyone here. Thank you so much. Thank you for Metrocom.com. Thank you.